Dr. Ryan Smith, and I'm here to talk to you about something quite uncomfortable, and that is urinary incontinence. So if it does make you uncomfortable, that's okay. It affects everyone of all ages, from prenatal women to postpartum women to men and everybody in between. And it not only affects our health, but it affects the quality of our life. The most important thing here is that there's a lot we can do about it, especially as physical therapists. Now, what urinary incontinence is what's considered any sort of leaking at all, even just a little bit. Now, that can happen when you're sneezing, when you're moving, when really there's a whole lot of activities that can happen with, and we would consider that all urinary incontinence. The kicker is that we know that incontinence can be affected by a host of things. It can be affected by our emotions and our perceptions and how anxious we are. It can be affected by what we're drinking, from coffee to alcohol to other sorts of liquids. But it can also be affected by how we move and different types of movement, all of which should be discussed with your physical therapist. But movement is what we can have the most effect on, especially if it's bothering you during exercise. So here are some things that we can do. So after you've kept track of how you feel when you have these incontinence issues, or what you might be drinking throughout your day, and you get those kind of solidified and out of the way, let's work at movements. And there's a couple ways we can categorize it. So there's impact movements, or things that I would label like jump roping or running, that involve some sort of impact or pounding in the body that can potentially cause incontinence or lead to incontinence. There's also things such as squats or lunges or any sort of traditional strength training movements, both of which can be problematic in their own ways, but all revolve around the idea of a management of pressure. When we breathe, it affects the pressure inside of our abdomen, which can put more or less pressure on our pelvic floor. And if we can't control that pressure adequately, both with impact movements and with overall strength training movements, well, then we're not going to be able to maintain our continence throughout those movements. So a good place to start is to involve the breath with your pelvic floor exercises throughout the range of both impact and through strength training movements. So let's go over this technique that you can use within all those exercises, and that involves breathing and pelvic floor. So if you've never done a Kegel before, it's a great place to start of learning to activate your pelvic floor. And all we're going to add to that is using an inhale and exhale method to give you control over your pelvic floor and hopefully over your continence with movements. So that starts off with a large inhale through kind of your rib cage. Almost imagine an umbrella opening up. And when that happens, what we're trying to do is relax our pelvic floor, or feel as though kind of those spots or muscles kind of right underneath our sit bones are sort of falling into the bench or our chair underneath us. After that large inhale throughout our rib cage, we're going to try to do an exhale and start with pursed lips. And what you're going to do is contract your pelvic floor or do a Kegel at the same time as the exhale, and you'll feel those muscles kind of underneath your sit bones slowly pick up and lift away from the bench. So it would look like this. And that in itself is going to help you dictate, can I combine my breathing technique with my pelvic floor contraction? Now all you do is take that simple method and add it into your various exercises. So with a squat, you might, for instance, come up like this, and as you inhale on the way down, and exhale on the way up, to allow yourself to exhale and contract your pelvic floor through that range of motion. You can also combine it with your jump, of an inhale right before you jump, and relax, and then exhale, and control that through that impact part of your exercise. All of that can help you differentiate between what movements are specifically kind of aggravating my incontinence, and can this breathing technique help me get through that? It's a major component in helping you take control over any incontinence you may be having, and not just in trying to go along the lines of, this is just normal. Incontinence is very common. We do not need to normalize it. Start with these three simple things of, how do I feel when I have this incontinence? Is there anything, anxiousness or stress that's bothering me? Are there any sort of liquids or something that's aggravating this condition? And then what movements specifically are aggravating, and can I use this simple breathing drill to help manage the pressure to get control over my incontinence? If you have any other questions, please reach out to Dr. Ryan Smith or any of us here at the Recharge team, or subscribe to us on YouTube for other specific videos linked to any of these incontinence issues or other health issues you might be having.